This is Andy Orm of O'Reilly Media. I'm talking to Janice McCullum, a health data analyst and a journalist who came to Strata, and I wanted to get her reactions. In fact, because I've been interviewing a lot of people today, I'd be really interested in some of your reactions because I missed some of these things.
Okay, well, I enjoyed the sessions very much today. What I'm seeing is progress is being made. People are using data. I've been watching the evolution of healthcare data, especially from electronic health records, for a long time. It's starting to take place. I think there's still a lot of issues to work out. So right now we're seeing experiments being done, some good progress being made, but there's not a lot of understanding of what the underlying business models will be. That somebody brought up the topic of data sustainability, or some of these big databases that are being created. Who's going to ensure that they're going to be around for a while? There's work that's involved, and maybe some of the value of the older data isn't as extreme or isn't as high. So what are we going to do to sustain some of the work that's being done now?
Well, we're sort of still in a startup phase where we're very idealistic and saying, let's move forward and let's just throw it out there and not thinking about sustainability, as you said.
Yeah, that's one of the issues we're not thinking about it enough, perhaps. Just rewarding the people who add value to the data is important, and I don't think the models have really been developed yet. Somebody this morning talked about, we'll charge for the data. It was from Paul from Optum Labs. We'll charge the equivalent of what an NIH grant would allow somebody to pay for data that they were going to be finding somewhere else. So we're relying on some old models when maybe some new models are needed.
So to get more entrance in the field, do you think the data should be really free?
I think, I don't know about free. I really believe that data has value, and that value can change over time. Jonathan Bush used the analogy of the stock exchange and how things have changed so much. And it's funny because I was just thinking this morning about stock exchanges and how when I first got involved in the data business, people paid for 20-minute delay stock price information. And now, of course, we get the information, and it's pretty easy to get stock price data free, and it helps make a transaction, and so the money is made in the transaction, in the sale. So I think down the line we'll see some models like that in healthcare, but we haven't even gotten to the 20-minute delay area yet.
I don't think maybe the way we do our financial transactions is a great model for anything in the world, but the data should be more freer, but also closer to the patient.
Well,
right?
I think transparent, and I think more symmetry. Or we have to get rid of some of the asymmetric nature of the providers have the data, and maybe we'll give you some data. Patient.
And this has been a focus for the Society for Participatory Medicine, whose button you're wearing today.
Yes, I am wearing that. Yeah, I think one of the lines of the Society for Participatory Medicine is give me my data, or give me my damn data. In some cases, data about me. And it's not just that patients should have access to it just because it's the right thing to do, but also we're talking about shared decision making, improving the value of health, and how patients can learn from the data. And I think they can, we're talking about patient-reported. There's a lot of emphasis on patient-reported outcomes at this conference. And I think we have to really make sure that patients have access to that data, not just the data, but also ability to analyze it and share that analysis with the providers. Because I think patients, we know, we do something, we can see the reaction. I think patients can provide a point of view that providers just never can.
Yeah, the patient's behavior is very important, particularly in chronic disease, which is growing. So we have to give the data back to the patient to affect her behavior.
I think that's true. I think it's very important in chronic disease, but I think it's going to be perhaps even more important in maintaining wellness, which I think is the ultimate goal. And one of my concerns, I went to an event, a quantified patient event at Athena Health. I don't know if you were at that a couple weeks ago. There was, and I saw some evidence of the same trend here where, okay, we'll be tracking data from patients and it's going to go directly to providers in some cases. That seems to be the prevailing business model now. Providers or payers will pay for access to that data. But I see very little focus on making sure that the patients have access as well. So it's been more of continuing on the paternalistic nature of medicine. The provider or the physician will have the data and they will tell you, Mr. Chronic illness patient, oh, you're eating too much sugar, your diabetes, your glucose level went up. So I'd like to see it more of a shared model than just the provider having the data and telling us as the patients what to do.
That reminds me that we want patients to also be more involved, more educated. And do you think that there are themes at this conference that we should take to a bigger audience so that the average person really cares about this?
Well, I'd certainly like to see more outreach and more explanation. When Optum Labs was talking this morning, they were talking about comparative effectiveness research, and that's gotten a pretty bad name in this country. It's been equated with death panels. I'd like to see some emphasis on getting clear information to the broader world about the value of some of the new technology and data analysis in healthcare and what it can do for us short term and long term.
Okay. Is there any other observation you'd like to make?
Let's see. Just one thing that just popped into my mind. I went to the session on healthcare, the M&A, and there's been a theme of what's going on with consolidation in this industry, and I guess there's some good and some bad. Some concern about consolidation on the hospital front and how that could be either good or bad. But I think the consensus in that session on M&A was healthcare IT is a good area. Healthcare IT and healthcare data is a good area for investment, and that no matter what little sidesteps we have or any kind of political issues, that it's a high growth area and should continue so for a good 15 or 20 years.
Well, part of the problem is that our health data is so valuable and so many people are kind of salivating at it. But
yes, that's true. So yeah, that's a good way of sort of ending by saying it's really important to make sure that we stay vigilant, that patients need to be protected, which doesn't mean that we won't share data, but make sure that the patient is remembered in all of these deals we're doing and the progress we're making.
Thank you, Janice.
Okay, you're very welcome. Thank you, Andy.